Okay, this is Reda Sadki from Geneva, Switzerland, welcoming you to the Week 1 discussion group for Module A1 of the WHO Vaccination Coverage Survey Scholar. From Marawish, who can only see names in the microphone, you should find an item under Window when you're in GoToTraining, through which you can see the window that is being shared with everyone. So we're now almost 100 people joining from all over the world. So I do want to emphasize the exceptional nature of this event, and actually we'll be experiencing this once a week and hearing from many voices from all over the world. So of course, in the session, you'll be hearing from, and I'll be handing it over to Carolina Danavaro from WHO, who's the lead subject matter expert in introducing the course team. This is the only discussion group session in which we'll be just throwing a whole lot of information at you. As you can see, the agenda is packed. I've circled in red that after the discussion group, if there are technical support questions, if you want to actually see sort of hands-on my walkthrough of Scholar, show you how you can find your pending tasks and so on, how you get started in Creator. We have recorded video tutorials, but we know sometimes it's easier to actually see that. So I'm happy to stay after the group. So an hour from now, I'll stay on if you have questions and would like support. So let's get started with some of the ground rules for the discussion. Let's get started. If you could type the city and country you are connecting from into the chat window. So if you're not familiar with how to do that, in the GoToTraining control panel, you'll see an item called chat, and at the bottom there's a little window that says type message in here. So Atlanta, Seattle in the US, Florence, Italy, Baltimore, Ethiopia, the name Sofia, Bulgaria, Gaziantep, Turkey, Tanzania, New Delhi, Berlin, Brasilia. Okay, the city and country names are going by too fast for me to read them, but there's obviously an amazing, absolutely astonishing diversity of people here. This is the diversity that the international, as an international community that we work in. But again, this is something to be enjoyed. Now, in this discussion group, your active participation is required. You are going to be and may be called on at any time to present, answer questions, give feedback. You'll be asking questions. Obviously, you're encouraged to do this in the chat window, to make comments as well during a presentation, whether that's my presentation or a participant. Now, you can also request permission to speak. And you have a little hand raise hand menu item in the attendees panel, I believe, through which you can actually request permission to speak. Presenters for the participant presentations will be able to share their screens, and as I mentioned, we're able to see both attendance and attention. So I thought that the strongest form of encouragement could come from people who have actually done this, gone through this before, and they're pleased to report that there are a number of people online who successfully completed the pilot course run by the World Health Organization using Scholar last year. This was about using the global routine immunization strategies and practices. The acronym is GRISP, to achieve better immunization outcomes, and you can see some of the outcomes of the pilot course here. And I've highlighted some of the testimonials. This is from Lokesh Sharma, who described how he managed during orientation week to survive, and basically he says that daily visits to Scholar are what ultimately did it. He was behind in the first week and successfully completed the course once he organized his time, and I believe he is in the session as well. There's so many names I'm not able to see everyone at once and have to scroll through. So that's the first piece of testimony that I hope will encourage you to persist. The second, and I think this is maybe the most significant one if we care about outcomes, this is what what was reported in terms of some of the outcomes from participation in the Scholar pilot run by WHO last year. I've given you what the acronym for GRISP. I'm not going to read the slides, obviously, but trust that you can do so. And here is the advice from Lokesh to new participants. My only advice would be for new participants to be regular in the course. I believe ultimately all of the completers in the pilot course realize that making it a habit is probably the single most positive practice that you can adopt here. So scrolling through the list, so that is the experience from last year, and I hope it will encourage you that to see to read this testimony, and we are here to support you, as we've said on WhatsApp and have already interacted with many of you. Basically, it will take a little bit of diligence, a little bit of effort to figure things out. This is a different way to learn from across distance, and even in terms of the different options for digital learning, this is there's some significant characteristics of the Scholar approach that we believe will be ultimately helpful to you, but that you first have to make your way up the learning curve. So just in terms of checklisting where we are in week 1 and where you should be. First of all, I've mentioned this link to view just the course team updates. You'll find it in the materials panel. So if you haven't bookmarked that link yet, what it gives you is it gives you just the course team updates. If you just go into the community, you will see everything in the activity stream. What you want is to first look at what the course team is sending your way. And then second, if you have time or if an assignment calls for it, then you'd want to go look at the other content that's being shared. Second, if you haven't already, download the concept note rubric and Harmonia fact sheets. You'll also find those in the materials links, but you'll also find those in Scholar in the relevant links. 3, if you haven't already, you have until Friday to post your week 1 community assignments. So yes, the presentation in response to the presentation for this discussion group is available as a download in the materials panel and will be shared in the community. So 4th point is to start your creator project. And we've got a set of tutorials dedicated to showing you that, as well as some additional guidance, of course. And then what we're doing the rest of this week, now that we've pushed out the initial set of instructions, is actually sharing updates that combine guidance on a specific section on the concept notes. So you'll find, for example, an update on what should be in your background and context for the concept note. And that's a combination of a video from our lead subject matter expert, Carolina Dannevrauer, who explains in general what should be in that section, examples from other subject matter experts on specific vaccination coverage surveys that they describe and we'll walk you through, and then the actual substance, the questions that you should seek to answer in the specific section. So there's 1 update per section, and there are 12 sections in all, and I'll be describing that in more detail later. So to give you a sense of who you are as a group, we are 125 people online right now from all over the world. To give you a sense of where people are coming from, this is the breakdown in terms of numbers. So if you are from a country of which you are the sole representative, that makes your responsibility. One point I'd like to emphasize or to make is then in a way you are carrying that country's representation within the Survey Scholar course, and I hope that will provide, at least for some of you, additional motivation to persist and to succeed. To give you a sense, just picked out a few numbers. Most of you have tremendous amount of immunization experience. Almost 3/4 of the participants who were selected by WHO have analyzed household-based survey data. 2/3 had heard about the reference manual, which of course you're all familiar with now. And again, one key message for this week 1 presentation is to go look at chapter 2 specifically, not as an optional activity, but as something that is mandatory that you should absolutely do if you haven't already. And then 60% of you have been directly involved in conducting vaccination coverage surveys. And also pleased to see that Dale Rhoda, one of our subject matter experts for this course and survey statistician, responds to these numbers with wow with an exclamation mark. So good to see you in the session, and thank you for joining us, Dale. Dale will be, well, I'll be introducing him in a couple of minutes. Now this is the full list of subject matter experts who've been involved with the preparation for the vaccination coverage survey initiative. And I'd like to focus on the 4 subject matter experts who you'll be seeing in many of the videos. Of course, I'm sure by now you have all seen Carolina Danavaro, if you did not already know her as a lead subject matter expert, and she's also contributed one of the case studies that you'll be seeing little bits and pieces of as you work through the case study. She'll be telling you what she did, how she did it, and why she did it with respect to a vaccination coverage survey in Bolivia. So, all right. Yeah. Okay. So, sorry, but I was hearing some background noise. I'm not sure who it was coming from. If you have, and I see one hand raised, so we'll have a time for questions, of course. So second subject matter expert is Chesco Nogareda. So he'll be presenting a Malawi case study, which was a vaccination coverage survey, post-campaign humanitarian emergency context. So a very specific context with very specific characteristics, and he'll be emphasizing, in fact, the importance of context. John Wagai will be presenting a Nigeria vaccination coverage survey that was integrated into the a larger population survey, on Friday, you will get to watch Dale Rhoda's welcome message, and he will be walking you through week 2 through issues, and in particular the sample size calculation. So these interviews, just as in the real world, you'd be interacting with these experts possibly, most likely, over Skype connections or over phone calls when you are not able to meet them physically. So I apologize for the quality of the videos, but I believe you should be able to see and hear clearly, and that is the main point. And again, whenever we can, we try to model the real world. And I can see Dharmesh Lai, who says, glad to have all wonderful experts' materials are well prepared. So of course we thank you and are grateful for your feedback, and we'll be asking explicitly for your feedback on Friday. You'll get to tell us privately and anonymously how you are doing. So we reached out to them to say, look, okay, let me see what is happening with my audio. Okay, it looks, yeah, are you able to hear me? Okay, yeah. All right, thank you for letting me know. Yes, so if you're here, you were selected out of a very large number of applicants, and that confers a special responsibility on you to engage and commit to this course. So again, we're not going to be chasing after you. You are responsible for your own learning. You're responsible for knowing what you're doing and for making sure you're up to date on assignments, on deadlines, and so on. We encourage you to make it a daily habit to do at least a quick check-in. And if you do have internet access issues, let us know. We have basically a full protocol so to help you so that you can work almost completely offline. You will need to occasionally connect to the internet. In the pilot course last year, this was an issue mostly with people who were doing field work in locations where obviously they did not have the access they usually would have. So you've seen the collaborative guidelines, but I've included them again in this presentation. How to keep up with the course. We've tried to chunk the activities, the updates, so that every update, or most of them, you should be able to complete in a 30-minute session. So this could be during a lunch break, this could be this could be in the evening, this could be in between meetings. Of course, you're free to do a number of updates or a number of tasks in a single sitting, whether you manage to set aside a couple of hours or an entire morning or afternoon or evening. We realize that as adult learners, you have full-time jobs and full-time personal lives and probably families as well. So we're keenly aware of that and have made our best effort to structure things in the course to allow for the realities of life. Nevertheless, I want to emphasize again that the bottom line is there is no way to progress and through this course without putting in time to complete the tasks and without putting in the effort to make sense of what is happening and why. All right. Let me see. Yeah. All right. So if you are feeling overwhelmed, confused, they're receiving a lot of email notifications. Yes, this is a completely normal feeling to have in week one. As you can see, and as you saw from the testimony from participants in the pilot course, you will get over this as long as you persist and don't give up, and we're here. We'll do everything we can to support you if you need individual assistance. All right. So now, before presenting the structure of the course and the full schedule for the course, you have all been working on Harmonia with a week one assignment. Around the third of you seem to have started with your creator project already. So I wanted to stop here and hand over to Carolina Da Navarro. I just want to remind you of the honor code before she speaks about the case yes, again, the presentation will be shared. In fact, you can already download it as a PDF in the materials panel in GoToTraining. You've all seen the honor code, and one of the ground rules is, because we're doing this open sharing of assignments, of course, in line with the honor code, you should only view those updates from other participants once you have posted your own. This is a outline of the structure of the concept note. All right, and that's as much as I will say. I want to, of course, unmute Carolina and really want to stop here so that she can introduce herself, the course, and the Harmonia case study that really you'll be working on in the coming weeks. Then.
Hello, everybody. I hope you can hear me okay. And probably you have seen enough of me in some of the videos, so sorry about that. So just briefly to tell you about Harmonia. Harmonia, it's created based on a couple of countries, so it's not exactly one country. But the idea of Harmonia, it represents a very common scenario with vaccines that are being introduced, with vaccines in the second year of life, with a census that may or may not happen, with surveys that happen but not as often as other people may want, etc. So I have read all of the assignments from week one as to the ones posted this morning Geneva time. So if you sent after 10 a.m. today, I haven't read it yet. And we'll be sending you some feedback in general, some generic feedback. We also are taking notes of the questions you have about Harmonia, some follow-up questions. And the most important part, so that the feedback makes sense, is that it's not a suggested resource, really. It's read the chapter 2 of the manual. This is the time to read it. Okay, so Reda, just thank you. So we'll be posting some considerations about the assignment of week 1, probably after everybody submits their assignment. And then for next week, we will continue with Harmonia, and we will review the strata that we're going to use. And if the word strata is not familiar to you, you can have a look at the glossary of statistical terms that it's on the Scholar platform. And we'll be looking at calculation of sample size. So then the creator project, it's basic, and Reda will talk more about it, but it's basically your homework for the module. It's your project, your concept note. At the end of the module, you will have done one concept note about Harmonia, and you will have reviewed other people's, and then based on their feedback of the people who reviewed yours and the feedback of the facilitators as needed, you will submit a concept note. So in this, through Harmonia, we'll cover several of the aspects included in the new WHO vaccination coverage manual. This week is really chapter 2. And then for next week, if you want to prepare, is the chapters on sample size calculation and all of Annex B, as in boy. Thank you, Reda. Yes, everybody will develop a concept note for Harmonia.
Thank you, Carolina. All right, so we've already answered one question, and Hadia Mirza says, my request is to make one icon for the weekly activity so that one can check for their own completeness. Otherwise, we will be searching for the updates. Yes, that's a good point. So we'll be, at the end of this week, we'll be sharing a catch-up guide that'll contain basically the recap of all the important links in relation to the project. So do look for that. When we share it, it'll be in the shares and in the week wrap-up update. Any other questions before we move on? You're welcome, Hadia. All right, we're going to deep dive into the course structure and the actual schedule. So, all right, let's keep going. And remember, you are welcome and in fact encouraged to chat, ask questions, make comments to the course team, or to interact privately. You can speak to each other as well in the private channels. So let's get started. You've seen the schedule overview. Right now we're only focusing on modules A1, obviously on the A modules, let's say, and we're in module A1. This is just a reminder of what we aim to do, the learning objectives that we have for participants in the course, and what we'll be hopefully supporting and guiding you toward in the coming weeks. You've seen this before. Now, to give you a sense of how we believe that the course will help you progress towards these objectives is on 2 tracks. In the community, as you've seen, the community is this kind of open space where we have community assignments that are open and shared. A number of subject matter experts will be contributing basically stories from the field of real-world vaccination coverage surveys and telling you both what they did, but also why they did it and why it mattered. So those we call explainers and storytelling, and that's all happening in the community space. In Creator, this will be your private space here where you will develop your Harmonia concept notes. So everyone will work on Harmonia, but that will be that will be happening in the creator space, and of course you'll find in the community the updates that will provide guidance for how to proceed. And of course there have been a number of questions about to sort of flesh out the Harmonia case, and we'll be addressing those once at the end of the week, once the assignments have been posted. So let me see. So from Nasor Mohammed, so the only task for this week is Harmonia concept notes. Well, that's the community assignment for this week is that week 1 assignment. The Harmonia concept note is what you'll be working on in the first 3 weeks in draft, then peer reviewing, and then revising. Tasneem asks, could we have a checklist of tasks before the week starts so we know where we're at? Yes, that you get through the learning module will be for week 2. We'll have hopefully the full learning module for week 2 up on Sunday evening, and we'll get the other weeks up as soon as we can. So you'll find the link to the learning module in the materials panel. Mulembe Ibama asks, will there be a separate application process for modules A2 and A3? I will ask Carolina to address that question. Let me go back. Yeah, I'm sending you an unmute request, Carolina, if you'd like to.
Okay, so for the modules A, that goes through now until December, so module A1, which is now, then module A2, which is more working on a protocol and focus on sampling and the the questionnaires with a focus on the vaccination questions. And then the third module, A3, that is analysis, all of you are enrolled already. So hopefully you will continue engage and participating. There is only one person who will join us for module 3 only. I hope that answers it. Thank you.
Okay, thanks. All right, question from Pamela Bravo. Are the assignments on a weekly basis? So we have weekly community assignments, and this is really the next slide in a way. Weekly community assignments for the first 3 weeks, and then the creator project, so the full Harmonia concept note, I'll be showing you. You'll be developing a draft in the first 3 weeks and then doing peer review and ultimately revising and hopefully improving a final version of your concept note. All right, let me scroll back up. George Bello, this morning when I tried to open the contributions from Scholar, it kept giving error and could not open. So there is, we've had maybe 2 other people who had login issues, and within a few minutes they were able to log in again. So this could be issues within your browser and your computer, or when the Scholar development team that makes updates or does other things like that. So don't discourage, don't get discouraged, and just try again in a few minutes. So the first assignment was good and realistic, says Bo Robert Brzezinski Pedersen. You do not have all the information at hand when you first engage, but when you start building a concept note, you're bound to have details available. As many has pointed out, the census schedule is a critical factor. I would point to additional time information. When is ROTA rollout happening? What is happening, etc. I'm really impressed by your work so far, but I wonder if it's possible to talk to someone in Harmonia, which I guess would be the most realistic setting. Apologies for posting this question now, but it does take time to write. Carolina, would you like to address that as well?
Yes, I just put it in writing. Yes. So at the end of your questions, you can ask questions about Harmonia as if we were the authorities of Harmonia, as if we were the EPI, your counterparts in Harmonia. So we do have a whole script, but if there are questions that are that you think are relevant, and I think you pointed out, or with somebody else, for example, a historical coverage series, yes, we will provide that. So please do feel free to ask any questions that can help you design the survey for Harmonia, because the whole idea of the concept note is to tailor this survey for Harmonia, and that's a big important message from this new WHO manual, that it's a reference manual that is supposed to be used for countries to tailor surveys to their needs, as opposed to the old way of doing things, that it was a bit more the same exact design for everybody. Thank you.
Great, thank you. Onojo Towo says this is great to hear that we're enrolled for module A2 and A3. Suleiman Haladu says, will the creator allow one to do the work gradually, or once you start the work must be completed? No, so no. Suleiman, creator, you can go in and work progressively. Your work is saved automatically, and you are in fact expected to work sort of piecemeal and then iteratively. So meaning you'll go back and refine and improve as you develop specific sections. And we've really chunked it again. We know it cannot be done or should not be done, in fact, in one sitting. So you'll find the updates provide guidance each time for a specific section. Next week we'll focus on the sample size calculation, and then week 3 we'll focus on the implementation aspects that you should include and consider in your concept note. James Dan Otieno, I'm not able to see day 2 tasks. Whenever I open the Scholar Shared update from admin, I only see day 3. Is this the way it should be? No, it's not. You should be able to see all of the tasks. Let me share with you the so in the materials panel, you'll see the link to see all of the tasks. Let me keep going. There's some really good. These are all really good questions. So thank you for sharing these. Okay, here we have one about substance. Majority of scholars' responses to question 1 was that Harmonia should conduct a survey. Demographic health surveys are usually conducted at least in 5 years. What is the correct answer for that question? So I'll turn again to Carolina, but it may be that we want to wait until the end of the week when everyone has submitted. Carolina, do you want to? Would you like to address that one? Okay, I think you may need to unmute yourself.
Okay, yes, we will share with you what happens in this story, because it's difficult to say that there is a correct answer for some things and an incorrect answer, except for things like sample size calculation, where there should be one answer. But for all these things that there might be differences of opinion, we'll just tell you what happens in this particular case and why. What were the main considerations that resulted in what happened in the country where Harmonia is based on after Friday.
Okay. Okay, great. Yeah. So I see more questions flooding in. Let's try to get through some of these. Sharing the presentation after the group discussion. Yes. Should we post every day our work in Creator? So you're free to organize your work in whatever way you want within the week. There are deadlines for pretty much each week. There's a question from Tasneem Pardapuri. Sorry, I skipped over that one. How many administrative divisions in Harmonia? Are there differences in coverage in the previous study? I don't know, Carolina, if you're able to answer that in the chat. Yes, if possible, move the deadline from Friday, if not to Sunday, at least to Saturday. So I'll leave that one open for now. Mesret Damte, will we have presentations from facilitators, or are we supposed to get the info from the WHO manual only? So Mesret, if you look at the updates, you will find presentations from the facilitators, from the subject matter experts, so from Carolina, from John Wagai, from Cesco Nogareta, and later next week you'll see the presentations from Dale Rhoda. So there's a combination live interaction in this discussion group, as you can see, as we're doing now, but really you can access their expertise and experience through the updates and the videos. All right, let me see. Let me try to keep up with the all right, I did a mistake to submit my draft concept notes as one person privately. That's okay, just unsubmit. You can click, you should see an unsubmit button. Don't click that submit button until you're actually ready to submit your concept notes. So the structure section of my creator does not allow me to edit the untitled heading. What did I do wrong? Try using a Chrome browser or Safari rather than Explorer or Edge. That would be my first suggestion. We do have problems with Microsoft browsers that are somewhat buggy. All right. what we'll do is we'll follow up any questions we don't address right away. We will follow up and address after the session in the update that will be posted to this. Can we get week 2 assignments and updates? We'll prepare and study on holidays. Yes, that. How often should one post in the community? That is up to you. What I think is not very useful is people who post sort of single word comments. We're looking for substance, and if you're going to post, then it's your responsibility to make sure you're posting something relevant and significant and of interest to your fellow participants. Okay, and I'm having trouble with the chat window skipping around, so I'm sort of floundering here. Okay, using Chrome browser. All right, well, we can follow up that on that question. Oh no, Joe, any difficulty you're having there after this session? So Mohammed says, I've not completed week 1 assignment. What is the deadline? So it is formally Friday. Carolina, I'll ask Carolina to comment on the late submissions, and Lydia says, I will be glad to get the correct response. Was thinking loud whether or not surveys should be conducted at any point based on the introduction of new vaccines. Usman says, dear team, do we expect tasks daily, or how frequently do we expect them? With so many emails and posts on the blog, there's a risk to miss something. So we'll be sharing the catch-up guide that will contain just what you need to actually get done. The deliverables are actually the next part of the presentation. So and I've just gotten the indication that you now have been granted until Sunday to complete the week 1 assignment. All right, so let's get back into this, because I think many of these questions will be answered once we've gone into the schedule overview. So you can see how the Scholar course is organized between community and creator on the other hand. So let's keep moving. How is a module organized? As you can see, the first 2 weeks, 3 weeks are the most intense. Weeks 4, 5, and 6 will be delving a lot more into the experience and expertise that you have, both participants and subject matter experts in the course team. You can see here an outline of the Scholar process. So really, when you write, you're obviously having to look at Chapter 2 of the manual. You're having to look at the resources that are shared, and you're having to think about what you're putting into that concept note for Harmonia. In weeks 4 and 5, you'll be giving feedback to others, and at the end of week 5, you'll receive that feedback that others have given you. So you'll be looking at 3 other concept notes and giving them structured feedback using the rubric that you're actually using now to get started with your creator project. So this is what the overview of the 6 weeks look like. So you can see we have assignments in the first 3 weeks, a focus on sample size and sampling in weeks 2 and 3. And you can see what you're doing in community and what you're doing in creator. And when we say in weeks 4 and 5 and going forward, sharing of experience, there the discussion groups will focus on participant presentations about real-world vaccination coverage surveys that you may be working on, and will get an opportunity to present and discuss and review from the concept note perspective in these sessions. So so this is where we'll call for volunteers. There'll be a limited number of slots, so we will be looking at making these a very productive and intense and creative sessions where you'll be able to contribute your expertise and your experience to help other colleagues who are organizing or preparing coverage surveys now. So here's the schedule overview again. So we're in week 1. We're really discovering a lot of things, but there's already quite a number of tasks to get done. As I've made the point, these are small tasks, yeah. Will we get the message saying that your week 1 assignment is completed? No, you can see your assignment, and then we're able to see all of the people who've submitted an assignment for week 1. So here's a deep dive into week by week. Here you have, so obviously the dates, the focus of the discussion group, the tasks and deliverables, what you have to learn about using Scholar. So yes, and then looking ahead, what's coming up basically. So that should be the sample size calculator. That's an Excel file. That's week 2. So week 2, what's coming up? So as you know, on Tuesday, we're very pleased that Dale Rhoda has accepted to do a hands-on workshop. He's one of the co-authors of the reference manual, a survey statistician. So we're going to be getting hands-on with the sample size calculations. He'll be using an example from a case from Burkina Faso. So not doing the Harmonia calculation for you, but showing you how to do sample size calculations so that you can then apply what you learned from the workshop to the Harmonia case. So that's coming up next week. Week 3 is going to be the focus on implementation. So refer to the rubric to see what is covered under that generic title of implementation. So this will be budget and timeline, ethical review, and other aspects. But the community assignment will be focusing on sample size calculation, basically showing applying what you learned in week 2, because sample size calculation is so central to the design process with the in line with the 2015 reference manual. All right. The workshop with Dale is at the same time as a discussion group, so it's just a day early. So it's 1500 hours, 3 p.m. Geneva. We've shared the links in the updates, so you can check the time in your own time zone. So the first 3 weeks, you're going to be drafting that concept note for Harmonia. By the end of week 3, we'll have shared all the learning resources, videos, explainers, other guidance, and this is where we'll shift into the second half of the course, where you will move to peer review. You'll be peer reviewing the concept notes of your colleagues, and then during these weeks, the discussion group presentations will focus, as I said, on the real-world coverage survey. So this, once you've put in the effort to draft that concept note around a fictional case, we'll be delving a lot more into the real-world dilemmas and design processes that some of you are right now working through, and you'll be sharing that with colleagues who may have done surveys in the past, or who may have surveys to do in the future, or who are interested in that topic. Let's see. So yes, week 2 and week 3 assignments. Yes, we're actually those are actually with Carolina and Dale for a final review and validation. So we're going to share as much as we can, as far ahead time as possible. Please note that we are making adjustments as we see how you are doing and as you give us feedback. So the more feedback we get from you, the better we can fine-tune and really calibrate the course so it works best and is most productive for everyone involved. That's another benefit of this approach that we're using, that we're able to make real-time adjustments rather than give you something that is set in stone. So week 4 is going to be focused on peer review, as you can see here. Weeks 4 and 5 are on peer review. So you'll have 3 concept notes to review, but once you look at the rubric and once you understand how the review process works, you'll see we really expect you to invest time and effort in formulating constructive feedback for your colleagues. As you can see, most of the group has a lot of experience. There are people who are who have joined, who have an interest in coverage surveys. We ask for your indulgence to them if you're amongst the more experienced ones, and take the time to give them guidance and support in the same way you would for a new colleague who is doing this perhaps for the first time. So that's peer review in the final week. And this one will seem to go by very quickly, because you'll be receiving the feedback from your colleagues about the concept note draft that you developed, and then your task will be to revise and finalize it. So that's the sort of week by week breakdown. Where you'll be able to find that is to get a sort of look ahead is in the learning modules. So when I say materials panel, I actually can't show it to you because GoToTraining hides it. But if you look in the GoToTraining control panel, there are items called timer, or where you see the audio items. You should see audio and then materials and then maybe a couple of other items. That's where you'll find the links to the course team updates, to the Harmonia fact sheet, to the honor code and collaboration guidelines, and to some of the other items I've mentioned in the presentation. Okay, a private message. Can I have a look on week 1 assignments of colleagues before submitting mine? Can I have a look on week? Okay. So please review the honor code. basically the bottom line is your work needs to be your work, your effort, your thinking. And of course, we encourage dialogue, but ultimately you have to take responsibility for what you submit. So that's the answer I will give to that one. Now, same question for concept note. So concept note, unlike the community assignments which are shared, your concept note and creator, no one else will be able to see it other than the course team. Will be looking at your work in progress and perhaps giving you feedback and guidance as you work. But your creator project is private, and you'll only be sharing it through structured, anonymous peer review. Now, certification requirements. For Module A1, there are 5 things that you need to deliver on in order to earn a certificate of successful completion. So first of all, there are the weekly assignments. We initially thought we would have 2, but we now have 3 assignments, so that should be weeks 1, 2, and 3. Then the first major deadline is the draft concept note by 15th of September. Then the peer reviews 2 weeks later, and the final concept notes by 6th of October with an average peer review rating greater than 2. So of course, so you'll be dependent on your peers, but your peers will be dependent on you. So that's why we really encourage you to keep up with the course, and that peer review process is going to be especially important, both in terms of the learning process and in terms of being able to get a feel for how you're doing in the course. And then participating in the weekly group discussion is also not optional. So if you are absent, we ask that you announce this, if you know ahead of time, of course, and then you're expected to view the recording and complete a follow-up task, which will typically be asking you about something that was in the presentation. So Bo Robert Brzezinski Pedersen, will you be assigning peers? I ask because I think I've seen a button for selecting specific individuals. No, so those are 2 different things. The peer review process, your peer reviewers will be assigned randomly. You can peer with others in Scholar, which is like friends in Facebook. So if you peer with someone, or if you get a peer request, it means someone's asking to be your friend, to be connected to you, so they can see they can see your activity in their activity stream. Dr. Pranit Kumar Fatale says, can we post our assignments in Scholar Group for getting feedback? So not the concept note, not the creator project, that's really in your private space. What you can post in the community is the weekly assignments. And of course, the honor code, the ground rule is only look at other people's assignments once you've posted your own. So your peers will be your colleagues in the course. Of course, the course team will be very actively looking at your projects and your progress as you work and during the peer review process. So one person, Caroline, is reporting that I'm breaking up. Dale says the audio is strong and clear on my end. Peers can only be peers only on Survey Scholar course. No, they can be from anywhere in Scholar. Of course, in this case, we really want you to focus on Survey Scholar participants and encourage you to share with them. All right, any additional questions? Obviously, I've been trying to address questions as they've been sort of flying by. If I've missed any, I apologize. We will be saving the chat transcript, even though it won't be available in the recording, and following up in the community to make sure we haven't missed anything. But are there any other questions at this point? We actually have 12 minutes remaining, and we've saved the best for last. So the participant presentations, there have been a number of people who volunteered in response to our message to share real-world vaccination coverage surveys that they are working on or have worked on. So I'm pleased to see that we'll have 10 minutes for that. Hopefully, Coadio Kobahunde says, could we continue to update our weekly assignment before the deadline? What you can do in practice is you can delete the updates that you have posted, if you're not able to edit it and repost something, I guess by the deadline, if from following this discussion group, there are changes that you would like to make before your final submission. And we've seen some very impressive submissions. We've seen some where people have included graphs and other details. Some people have chosen to do it as if they were actually crafting the email. So let's see, before we move to the participant presentations, I've seen some hands raised. Okay, and the private question, is there additional benefit of going through the whole manual right now? Would you suggest more selective chapters for better performance? So the basic guidance from Carolina is read chapter 2. Of course, if you ultimately the manual is intended to support precisely the work that you are doing in this course. All right, so, okay, good. Kubanishbek Monolbaev has a single word message, clear. I hope that's something about the clarity of the presentation. Certainly there have been some excellent questions. With 141 people connected, we can hope that this is, okay, and I see a couple of hands raised. Let me go in alphabetical order, but just so we can hear some of the voices. And we've had 4 people who, Adama, are you able to speak to us? Okay, all right. So it doesn't seem to be working. I'll keep you unmuted now. And let's see, there was one other person, which was Jaurès Churchill. And I'll unmute you as well. Okay, all right, so maybe I'll just mute everyone again. And in the time remaining, so we have, first up is Pamela Bravo, who was actually the first person to respond to the call for participant presentations. And Pamela, are you able to speak to us? Welcome.
Hi, everyone. Greetings from Brasilia. I'm right now in a duty mission here, so I'm just going to go over very quickly to the vaccination survey that we conducted a couple years ago in St. Lucia, which is an island in the Caribbean. The question here was a comparison question. The Ministry of Health was having doubts in terms of the vaccination coverage with the second dose of measles, mumps, and rubella vaccine. So that was the main objective of implementing this survey, just to assess the hypothesis whether this coverage was higher than the administrative coverage. The target population was children aged 6 to 11 years old, because MMR2 is given between 4 and 5 years in St. Lucia. And at the end, the hypothesis was not corroborated, because we found that the proportion of children who were vaccinated were lower than the authorities might thought. So the administrative coverage was between 62 and 79%, and the children that we found that were vaccinated with MMR2 was around 75%. The survey really helped the Ministry of Health to implement some intensification of vaccination activities to catch up these older children who were not vaccinated with MMR2, and those efforts right now are ongoing in the country. Thanks.
Okay, that was very concise, and of course these questions are directly related to the first part of the concept notes you're working on for Harmonia. To move the timer, you just drag it away. Are there questions for Pamela? What else would you like to know about this vaccination coverage survey in St. Lucia? There is Pamela has shared the executive summary for this survey. And yeah, do you have any questions for her at this stage? Otherwise, I'm looking for Ranjitesh Kumar, but unfortunately, Ranjitesh is not connected to the audio. Okay, and the comment from Carolina, it was very useful for the country. That's the main value of this survey in St. Lucia. All right, and let me look for Sanjin Musa. So, okay, here's a first question. Raul Camadris asks, who paid for the St. Lucia survey? Pamela, would you like to?
Yes. So this was a survey that was funded by PAHO, but not entirely. There was commitment from the Ministry of Health to also fund some aspects of the survey, some of the operational logistic implementation, and PAHO contributed with some funding for hiring the field coordinator and the biostatistician, and pay for some of the logistic operations as well. But that was, like, I will say, like 50-50 in this case.
Okay, great. I'm just looking for, all right. So thank you, Pamela. Any other questions? I realize, and of course, the point of sharing this is also to help you in your thinking about the Creator Project, and also to share between practitioners. And we'll be doing a lot more of this once you've submitted your draft project. So I see Sanjin Musa. Let me unmute you as well, and let me turn off the timer. It kind of gets in the way, but it does help to manage time here. So Sanjin, you are currently working on a protocol for the Federation of Bosnia-Herzegovina, and yeah, we'd love to hear from you. Are you able to speak, Sanjin?
Yes, I hope that you can hear me. My name is Sanjin. I'm from Bosnia-Herzegovina, actually from Sarajevo. Can you hear me?
Yes, we can hear you loud and clear.
Okay, so perfect. So I will just give you just shortly a background for the survey which we are currently doing. So we are now in process of developing of protocol for the survey, and we are hoping to finish it till the end of the September. It's practically one part of the TIP survey. It's a tailoring immunization program, which is the actually project developed by WHO Euro. And the main objective of this survey was, among others, to assess the characterization of parents in a different vaccination group who actually fully vaccinated children on time, who vaccinated but delayed, who partially vaccinated, and child who had no vaccination at all. So, but I spoke that with Carolina, maybe that goes in the second week of this course, but I can just give you some of my main concern is this, that during the shortages of time to do it, and the shortages of budget, of course, because it's not the main objective, and I would like also to assess the vaccine coverage for all antigens recommended for children between 12 and 23 months of age. I would like to, and that was my main question to Carolina, can we do it in study design, can we do it facility-based cross-sectional study instead of the home-based?
Carolina, yeah, so we're going to ask Carolina to respond and feedback at the end of the presentation, but let's hear on this specific question in response to your query. Yep. Go ahead, Carolina.
Okay. It really requires a little bit more discussion. I think the main point here is that if you want the survey to be representative of the entire country, you have to ensure that your universe, so your sampling frame where you're going to take your sample from, includes everybody, that people have a non-zero unknown probability of being selected. So if you do health facility based, you may have the possibility of leaving out children who may not receive any vaccines in the health facilities. But we can talk about that in more detail.
Yeah. Can I add something?
Yes.
I would like to say that, for example, that we are upper middle income country, so I think that we don't have that problem of children who are born outside of the healthcare facilities.
That's why we would have to discuss more your setting, because we would need to see what data it's available there to support that, and how you make sure that that's actually the case, and it's not that you're really only reflecting children who have access. But again, that's why I think it's longer than for this audience.
Okay, great. I apologize because we are out of time. There are more questions in the community. I want to thank both Sanjin and Pamela for their presentations. This is to give you a taste of what we'll be doing much more intensely with participant presentations. So thank you both for being the first ones up. And next week, of course, we'll be commenting on the Harmonia case, but deep diving into the sample size calculation with Dale Rhoda. So if you need to go now, we're going to be tight on time, on punctuality. We're going to run this with, shall we say, Swiss punctuality. So I want to thank you, first of all, for being present in such great numbers, reflecting the enthusiasm and leveling of engagement we're seeing in every space we're using for the course, whether that's Scholar or GoToTraining or WhatsApp.